Hello, everybody. This is Julia Thomas from the Canadian Association of Schools of Nursing. Thank you for taking part in our webinar today. We have the pleasure of having Marian Lecter-Floyd from Queen's University and Jane Tyerman from Trent University, who are going to be speaking to us about innovations in teaching and learning, and the use of virtual simulation games in nursing. This webinar has been offered by CASN Simulation Nurse Educator Interest Group, and I'm going to turn the mic over now to our interest group chair, Dr. Leslie Graham from the University of Ontario Institute of Technology.
Thank you so much, Julia. And again, I just wanted to remind everyone that Julia will be recording this for people that are unable to attend this afternoon session, although we did have quite an interest in this topic. So it is such a pleasure to introduce today's speakers who are well-versed in simulation pedagogy. They have widely published, have done research and published it, on simulation and contribute to the science of simulation, most recently with their systematic review about pre-briefing. As the founding presidents of the National Simulation Organization, CANSIM, they continue to contribute to the simulation community through their work with virtual and serious gaming. Both of our guests today are well sought after speakers and have presented their work nationally and internationally. They have been instrumental in helping large and small academic centers in developing innovative teaching strategies for experiential learning. So please join me in welcoming Dr. Jane Tyerman and Dr. Marian Lecter-Floyd. I'm going to hand the mic over to them both. Thank you.
Well, thank you very much. I am Dr. Jane Tyerman from the Trent Fleming School of Nursing, and I really want to thank CASN for the opportunity to talk about these innovations that both Dr. Marian Lecter-Floyd and I are involved with. And I'm Dr. Marian Lecter-Floyd, and Jane and I have been involved in simulation since 2005, when the Ontario government funded simulation equipment for schools of nursing. And so we've grown up with simulation, and we're very excited to share our knowledge with you. So we're going to talk today about innovative strategies in nursing education. We're going to talk about the collaboration involved with the Canadian Alliance of Nurse Educators using simulation, and different collaborations that we've been involved in with research, and talking about some of the collaborations that are currently out there for looking at virtual gaming and virtual gaming development. We're going to give you an overview of virtual simulation games and how they're used in nursing education. And finally, we'll talk about a faculty development program that both Marian and I are involved with that will help nurse educators to develop their own virtual games. So our interest in virtual simulation games is fairly recent, but I want to talk about the collaboration that really set us up to pursue this avenue. And in 2014, those of you from Ontario may recall that at Queen's University we led a large project across the province to develop simulations to prepare nursing students for clinical practice and patient safety. And we also were able to acquire new simulation equipment. But what was really the best outcome of this project was the collaboration that occurred between faculties from across the province that had never happened before. And so we were very excited about this. And as a result of this, we had the Ontario Simulation Alliance formed. So we had project outcomes from this group were the Ontario Simulation Alliance, and we took an extra training course in California. It was almost a train the trainer with the California Simulation Alliance that really helped us to learn how to teach individuals and other faculty members to develop really strong simulation scenarios and all the facilitation components, including debriefing. We were able to create a few scenarios while we were in California and had the unique opportunity of actually acting them out and being the students. From this came the Ontario Simulation Alliance. The group that went to California was a group of nurse educators that I've never been able to work with to that capacity before. They are amazing, absolutely amazing. So from that, we were able to build, and through the project, we were able to build 39 bilingual scenarios that are available to be shared across Ontario in a repository. This also created a standardized template, so we would have the capacity to have standardized teaching and a standardized evaluation method. The evaluation method that we chose to use was a rubric based on learning outcomes that were embedded in the scenario that really served as the foundation for your scenario. Through the sharing of these resources, we found it was very cost savings, and we were allowed to access expertise not otherwise available to us. Each one of us that are listening to this webinar or involved in the webinar have our own unique specialty areas, and how better to tap into that so that I can share your expertise with my students, and anything that I have to share with you or Marion has to share with you, we would love to be able to have that capacity to share knowledge and scenarios. So the collaborations in nursing simulation from the initial grant involved the Ontario Simulation Alliance with nurse educators across Ontario involved in that. We had, I think, around 40 different members that are, growing each month. So we're very excited about that. From that, we had a lot of interest from nurse educators outside of Ontario. So from that, we developed the Canadian Alliance of Nurse Educators Using Simulation. Different than the Ontario Simulation Alliance, we have our own rubric design template, a peer-reviewed template, and we've merged off into developing virtual games and virtual game workshops. We also have the collaboration of CASN, Canadian Nurse Educator Institute, that has been involved with the simulation interest group that many of us are in right now. And from that, we have also, just in the past year, developed the certification program. It's the CASN Canadian Simulation Nurse Educator Certificate. I would encourage anyone who's not involved in that or is not aware of that to please look on the CASN website. It's a fantastic program, has 4 modules involving development, facilitation, IPE, debriefing, evaluation, and scholarship. Those are offered through the year, and at the end there's a certification program that you can have your CCSNE credentialing, which I think is fantastic. There's nothing like that in Canada currently, and I think in the future it's going to be a huge draw for you for employment, and it's going to expand the knowledge and expertise of nurse educators using simulation in Canada. As far as virtual games beyond CanSim, there is a virtual community of learning, which again is nurse educators from across Canada. The website can be found. I can give you access to that website, but it's the virtual community of learning, and they're sharing resources for research and games that are currently available, freely shared. So that website is a great resource, and anyone of interest who wants to join that, it's a fantastic organization. So out of our collaborations, we've also created a number of research collaborations. So a number of OSA members were on the pre-simulation preparation systematic review that we completed, including Leslie and Jane and myself. And we also worked on a survey of faculty across the province to find out what type of pre-simulation preparation and briefing they were currently conducting. We've also looked at virtual simulation games, and over a year ago we received funding from eCampus Ontario to develop simulation games, and there were 5 faculty members from 4 sites across the province that were involved in that. We were looking at cost utility of using virtual simulation games for pre-simulation preparation. We were looking at the learning outcomes that would occur in terms of knowledge and performance, as well as anxiety in the students. And then we were looking for new collaborations to create new games that we could incorporate into our curriculum. So really, what are virtual simulation games? Well, they're simulation games that are used for educational purposes. So they might still be fun and engaging, but the purpose is to educate. And what's nice about the virtual simulation games is it puts the decision making into the hands of the student. And when they're participating in a live simulation, they might not all do the decision making, especially the shyer ones or those that are less confident may stand back and let the stronger students do the decision making. But with a game, nobody's watching you play the game, and you can go through it and make those critical decisions. The nice thing about virtual simulation games is that you can portray client conditions quite realistically. On the video screen, we have active learning occurring, and there's lots of ways that we can use the games. So we mentioned that we've used the virtual simulation games for pre-simulation preparation, and then the learners come into the lab and complete a full simulation, and hopefully that preparation will translate into a better performance in the live simulation. And we have literature that supports that virtual simulation games do result in learning outcomes similar to those that come from live simulations. And interestingly, we've just heard today that one of our colleagues are using the virtual simulation games as a teaching tool in the theory class. So showing the game, going through the decision point, and asking the class as a whole, what do you think is the best decision to make, and having that nice live debrief and discussion about each of those decision points. So it's also a teaching tool that can be used in the classroom. Absolutely. Oops, I think I went the wrong way. So there's a number of different types of virtual simulation games that can be used in nursing. There are a number of commercial virtual simulation games. So this is one example, VSim, that are being used quite a bit. And if you read the literature on virtual simulation games, a lot of them are using or testing these commercial virtual games. There are drawbacks, though, however, even though they're really well done and there's lots of interaction that you can do, that the students can do, they're expensive to use, and there's generally a cost per student. And so that has to be factored into your budget, so it can be quite expensive, especially if you want to use a number of different simulations. Other simulations are avatar-based, where the person takes on the role of the avatar. And so there's a number of different ones where you can do health assessments or you can do interviews with these virtual patients. Another type of virtual simulation game uses actual video footage, so it's not animated, it's video clips of nursing situations. They might be filmed from first person or third person, depending on the type of game that you're using. So this is one here, the blood vein nursing station. Another virtual simulation game that was created in Canada. There's a series of virtual simulation games that were created through an alliance of educators from George Brown, Centennial, and Ryerson University. And so if you go on the Virtual Simulation Community of Learning website, you will find all of these games there. They're open access, so that means they're free. They were created through grant money, some from eCampus Ontario. I'm not sure if there was some from others. These are really well-made scenarios or games. You can also access the Virtual Community of Learning through the Ontario Simulation Alliance webpage or the CANSIM webpage, which is www.can-sim.ca. There will be a link to the Virtual Community of Learning on that website. So as I said, these were very well done, and so we are using some of them in our curriculum here at Queen's. But we have to take into consideration that it took several years to make each of these, and that it would require a large production team as well as a fair amount of funding. So I think each of them were $100,000 of funding. So if you want to create more of them, you need to secure some funding and some IT support. So virtual simulation games we used for pre-simulation preparation. One of the things that we found in our systematic review and our qualitative feedback, and we also completed a survey of Ontario nurse educators that is expanding across Canada and now going internationally, the survey to find out, what's happening with pre-simulation preparation. And what we're finding is there's no standardized method, and students oftentimes aren't engaging in that preparation or completing the preparation unless there's some sort of reward, such as marks associated with that. We all know that in completing the pre-simulation preparation is key for successful functioning within this scenario, and it also decreases the anxiety. We have seen students that are so anxious in simulation that it really impacts their learning in a negative manner. So we developed 4 bilingual virtual games, and I have to emphasize the bilingual piece of that. In Canada, we have very, very few resources that are available in French for our learners, which is quite concerning. So we made a conscious effort to make sure that these games were bilingual. And on top of that, all of the scenarios that we have through CASN in the OSA are also bilingual. So the games that we chose were de-escalation of the angry patient, and one of the reasons for that is that students aren't getting that opportunity in the clinical setting as students to practice skills of that verbal de-escalation, so we thought it would be a nice opportunity to do that in simulation. Respiratory distress is across all areas of nursing, so that was an important one, as is a diabetic ketoacidosis, and finally an elderly urosepsis case. So we developed these 4 games to align directly with 4 of the simulation scenarios that had been developed previously from our large grant, and so they were to be used in collaboration with those particular scenarios. And for those of you who have received grant money, we thought it was a 2-year grant that we had applied for. It said 2 years, but it actually turned out to be a 1-year grant. And not only did we have to make these games, but we had to do the research component looking at knowledge, clinical decision making, and anxiety. So it was very paramount that we quickly, effectively made these games. So we were able to make all of these games in a total of 4 months, which was a great thing. So to do that, we needed to have a user-friendly approach to creating these virtual simulation games. And that we wanted, when we were developing it, we thought we needed to make it something that can be replicatable for other educators. So we specifically selected equipment and software that would be inexpensive and something that educators would probably have or have the financial support to purchase if needed. These virtual simulation games followed a similar format to other games that are out there. Basically, it has a video component, then it stops and has the student make a decision. These decision points come directly from the learning outcomes. When we select our learning outcomes, those are the key things that the students should be able to show us as they go through the scenario. So it's important for us to have these game points based on those learning outcomes. So this was the respiratory case, an intervention in response to a patient's complaint of shortness of breath. And these are always prioritized nursing interventions. It's a great opportunity with the capacity to film. Not only are we teaching with the decision points, but we're also role modeling in the video. So if you're showing a respiratory assessment and then asking what to do, you can really show the learner how to perform a correct respiratory assessment. And so with each incorrect answer, so there's one correct answer, there's a second answer that's correct but not as correct, and there's one incorrect answer. So with each of the correct or incorrect responses, as a student clicks on that, rationale is provided. Initially, we were only showing rationale for the incorrect responses, but students actually asked us to tell us why they were correct, the correct ones. And that really speaks to, was it a guess or did they know why? And they always want to know why. So this is a great opportunity for you to role model in the video and then teach in your rationale component. So we have an example, just a short clip of one of our games that we made as pre-simulation preparation. The difference between pre-simulation preparation and some of our other games is the length. You can, with our gaming template, you can have as many decision points as you want. So we consistently had 5 decision points with 3 options on each, and that really stems from education research that tells us the maximum or the optimal number of choices to give to a student is 3. So I'm going to show you here. Can you hear that? I might have to turn the speakers up. No. No audio. Okay, just give me a second here. Just let me. We were trying to get rid of the echo. Sorry, how do we do this, Mary? Go out and then put your speakers up. Okay, my apologies, everyone, from current slide. Okay, we'll try this again. Hopefully there won't be too much echo.
We have a new patient in exam room 2. Can I give you a report regarding his care? Sure. Mr. Sarrazin is 67 years old. He came from his home with an onset of agitation and confusion over the past 48 hours. He hasn't been eating or drinking very well for the past few days and has a Foley catheter inserted for benign prostatic hypertrophy. His medical history includes hypertension and osteoarthritis. He has an IV of normal saline infusing at 30 milliliters per hour. Can you assess him? Sure, thank you.
So here you can see that the students have to make a decision on what do they do, and one of our learning outcomes was specific to restraint use. So it gives the opportunity for students to decide, do they remove the restraints immediately? Do they keep the restraints on for safety, or do you remove the restraints with the assistance of a second nurse? So I'll go to the next one and then we'll show you what happens with each one of these. Here's one of our games on respiratory distress. So it's a DVT to PE.
Hand out. Big deep breath in.
Oh, God.
Okay, Maxine, you can lie down. Where does it hurt?
My chest. It hurts when I take a deep breath.
How does it feel?
Like sudden, sharp pain.
Okay, on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain in your life, how bad is their pain?
Probably 6.
Okay, and does it radiate anywhere else?
No, just my chest.
And you're still feeling short of breath?
Yeah, a bit. I just don't feel well. Something's not right.
So here you have the priority nursing action in response to a patient's complaint of pain. They're having to decide what they would do, or call the physician, perform a 12-lead ECG, or administer nitroglycerin. Here's one of our games that are available in French. Here you can see all of the instructions are available in French.
Allô, Anya. Je vais prendre soin de Willow Rosenberg aujourd'hui, puis je suis ici pour recevoir le chiffre de rapport de nuit. Comment ça a été durant ta nuit? C'est occupé, mais ça s'est bien passé. Juste, non, d'aller me coucher. Donc, Madame Rosenberg, c'est une jeune femme de 23 ans qui est admise à l'urgence pour ACD. Elle est arrivée sur notre unité à 6h45 ce matin. Donc, Willow est déménagée à Ottawa récemment pour entreprendre une maîtrise en sciences de la bibliothèque. Cette dame a eu un diagnostic du diabète type 1 il y a environ 8 ans. Elle comprend bien les symptômes, mais elle gère bien les symptômes. Donc, Elle est rentrée parce qu'il y a 48 heures, elle a commencé à avoir des douleurs abdominales, la nausée, vomissements. Puis elle a aussi moins d'appétit depuis 4 jours. Il y a 48 heures, elle a enlevé sa pompe d'insuline à cause des symptômes d'anorexie et de vomissement. Quand elle était à l'urgence, ils ont fait un rayon X de son abdomen.
So you can see from those, and we're going to go through and show you some of the decision points with that, but it's really important that we provide that bilingual component of it. All of these games, so except for the one game that you saw with the respiratory, all of those actors were actually friends, family members, or students. So there were no cost beyond our initial cost for making the game, which we'll go through. We've also worked to develop some IPE video-based virtual simulation games because not all facilities have the capacity to do IPE. So this is a great opportunity to do this. Marianne is looking after, or is involved with a student doing their master's, and here he's creating a game on a VFib arrest.
And so he's just implementing the game right now with a group of fourth-year nursing students and collecting data on whether or not playing this game will help prepare them for what we call cardiac resuscitation rounds, where they actually participate with other medical students and residents. So we want them to be well prepared before that.
So we'll show you an example of this game. So here is, it's in the middle of the game here. And
hi, I'm Dr. Jones. I heard the code. What's going on?
Hi, we have a gentleman here who is unresponsive and doesn't have a pulse. We've started CPR and put him on the monitor.
And what's the rhythm?
It's ventricular tachycardia. I think we need to cardiovert.
Wait, those are narrow complexes for VTAC.
so that was the choice was wrong, the one that they selected.
So you can see that Jane and I were actors in this game, and the graduate student was the one wearing the GoPro and filming, and then I had a undergraduate student who was performing the CPR.
Sorry that the nurse looking after the monitor wasn't more excited to be there. We were then, after we made these games and presented at a few conferences, we were contacted by the Alberta Children's Hospital with their flight team wanting to see about making their own game. We ended up traveling to Alberta last May or June, and we created a coartation of the aorta, which is specific to things that they will see. There are very few resources out there. They already had the scenario, so we were able to adapt the scenario, write the script, a full 10 decision point script in one day. We thought the next day we would film maybe 1 or 2 decision points for them and let them continue on their own. We were able to actually film all 3 options for 10 decision points and show them how to put the game together, and the game is now available for free. And this is also an IPE. We have a pediatric intensivist, we have respiratory therapy, we have the flight nurse, we have the nurse, the ECMO nurse. So there's lots of individuals here.
And one of the unanticipated outcomes of this was that they felt that it was a great team building exercise to create this game, because it was bringing together all of these different health professionals together to create the game.
So there are no paid actors in this.
Nope.
So they were all team members, and it was great that they said that it was so well received, especially because they knew, oh, well, my friend was involved in this. I'm definitely going to look at it. So it was another incentive for them to participate. So I'll show you this. This is actually about intubating the infant and whether the family should be involved or should be in the room during the intubation.
Or let's intubate here.
Dave's parents are here. Is it okay for them to come in and see him?
Okay. Okay.
What's going on? What's wrong with him?
So what's the best response to the parent's request to be present during intubation? So they're given 3 options. This is where they are asked to leave.
Can they just go wait outside? Wait, it's not
Outside?
No, we want to know what's going on.
just stay in the room.
Well, go outside the door until someone gets you.
Gabriel.
A little bit of humor there. And you'll notice the game is a little bit slow and staticky here. It's only because I've transferred it on. It flows very nicely when you're looking at it on the online. So that was wrong. So the correct answer here.
Let's have a seat right here and explain what's going on. So right now we're giving the kids respiratory effort a little bit of a break. We're going to tube down there and help them breathe.
Oh.
So it supports effective communication with the family. At the end of the games, you get a certificate of completion. There is the capacity to get scores on how many times students played the game, what their score is on each game. You have to decide where you want all that data to go. It makes it a little bit more complicated. So what we've done for these games is to give you a certificate. It doesn't matter how many times you played the game. The whole thing is, did you play the game? Did you complete the game successfully? For you to move on to the next decision point, you have to select the correct response. If you select an incorrect response, it'll go take you back and say, try again. So to get to the end of the game, you have selected eventually all correct. Here you'll get a certificate, and we've embedded at the very beginning, we ask you what your name is, and then I've been able to link the name onto the certificate. So students can print the certificate of completion when they're done. If you want to use that, if you're using it as part of a marks, or if you want to use it for pre-simulation preparation, this will be your proof that the students have completed the game. So the steps to creating a virtual simulation game is something that you can do. Marion and I were able to do it. We are not techie people. We are nurses, great. We are educators, awesome, but we are not tech savvy. We're getting a little bit we feel tech
Jane's
savvy.
pretty techie now.
We are trying, only from trial and error. So basically, you start with a selected, validated simulation scenario. And so you'd have to decide, do you have the capacity to film? Do you have the actors available? And you can do anything. You can do it in the community, you can do it in the hospital, wherever you like, and you can do any scenario, which is great.
We do recommend that you have learning outcomes that you're going to use for your scenario, because that really guides creating the decision points for the game.
Right. And so you've got your learning outcomes, then you create your storyboard. So you have your decision points, you have your correct, your partially correct, and your incorrect, and then we start developing your script, writing your script. And your script involves not only the words that are being spoken, but the environment, emotions, feelings, different things that you want to portray. The equipment, this is the only equipment you need to make the game. You need a GoPro. We use a Hero 5, and that seems to work nicely. It has somewhat of a stabilizer on it, which is nice, and it has the microphone. You can use an iPad and an iPhone. Everybody probably has one of them. And the great thing, you don't have to have this, but the great thing is, while it's filming with the GoPro, you can actually link it back onto your phone, so you can watch the filming from a remote location to see exactly what's happening. On your iPad, the reason why we have this capture app, it's a free app through GoPro, and that's linked onto your phone to watch this. You can actually start and stop your GoPro from your phone using this app for filming. Articulate software, this is the platform. So we have created the template for you, the gaming template that is for online use. It uses Articulate software, so you will need that. Most universities and colleges already have the Articulate software. If you don't have it, it's $600. But you'll have to talk to me and I'll tell you how to get it for $600. I'm a wheeler and a dealer. And so that's, and once you buy it, you only need it once. You only need to purchase it once, and then you can make as many games as you want. You need an appropriate area to film. If you have an appropriate area for your sim, it's the same thing. You just want a space where you have the equipment, and ideally a small enough space so that you don't have too much echoing. We did find that the larger the space, the more echo was involved. So a smaller space is ideal. Actors. So you can pay standardized patients. I think we have some colleagues in Toronto, and they said the standardized patients in Toronto are around $100 an hour. We use standardized actors twice and never again. We're up to about 20 games we have right now. Your friends, your family, you are all actors that didn't know you were actors.
Your colleagues and your students. Students love participating in the games.
You'll be the quieter ones are even the best.
Just make sure you get a signed photo release form from them, though.
Absolutely. So actors, I've used pretty much everyone in my family. I still have 2 victims that I can pull into it, but otherwise they've all been there. Marion's family's been. So you don't need to pay anyone. You have actors, and they're more than happy to do that. And then if it's someone that you know or the students know, they're more, as we said, apt to watch the game. The props, medical equipment, and supplies is exactly the same that you would need for the scenario. So it's usually what you already have available.
So after running our virtual simulation game the first time, I did collect some qualitative feedback from the participants about the game and how they felt about it. And so there was a lot of positive feedback. There were many people that mentioned that they were visual learners, and this one student said that it really helped them to focus and learn. There were a lot of comments related to the rationale, that was very helpful for them. And so seeing the incorrect responses and why they were incorrect was very useful to them, as well as understanding why the most correct answer was the preferred answer. A lot of them commented on that they liked the novelty of the games versus having to read, because a lot of them don't like to read, and we know they don't do all the readings we assign. They found it more engaging, and they liked the interaction. They thought it was relevant and that it was an active way of learning. And then the final comment here, which again was one of our goals, the students said, I felt more prepared and less anxious. And that's really what we were hoping would happen, and that they would come to the live simulation feeling ready to go and not too anxious about the content that they were going to be facing.
So the impact of virtual simulation in games in nursing education has been well explored, or is starting to be well explored in research. We do know it's cost effective when using the equipment that we have available. You can spend from nothing to a lot of money. So it's up to you, whatever you have the resources for. We've been at lots of different simulations, conferences, and there's some great 3G virtual games that are.
Yeah, the virtual reality stuff is really cool, but you need space and you need money, and you can really only have one person doing it at a time.
Yeah, so I think I talked to them just a little while ago, and they said it's about $10,000 for 100 students per one semester. So if you have that money, wonderful. My university doesn't have it, which is understandable. I think it's a lot of people don't have that. So what we found, our process is very cost effective. We're making games now for free. Now, when I say free, they're free because Marion and I,
it's your time.
Yeah, are not charging our time, and our husbands and children and mothers.
We give them pizza.
Well, sometimes, we just get our undying gratitude, which is great. Doesn't cost anything. It's safe because we have control of everything that is happening. We create the scripts. We have the scripts vetted by other professionals that we work with to make sure it's engaging and interesting. We're talking to a younger generations that are very much computer oriented. So they want to be involved in this. They want to try something that is relevant to them, exciting, interesting, even new. Let's try it.
And they have short attention spans, so these short games are great for them.
Yes. It has to be accessible. So, and it makes it more accessible. Not everybody has IPE. Not everybody has equipment. Not everybody has the expertise. So making these games, they are being shared right now internationally. They're being used in the States, in Canada, and we've recently been we've been in talks with people internationally that want to use these games. And we get it for remote areas, those who are northern or don't have access, they can access these games. It's a standardized method, so it's the same through for everyone using it, so you know what to expect. We have a method to create the game. It's very user-friendly. We've used it multiple times, and it keeps on becoming refined each time we do it. We have the capacity to evaluate knowledge. In the games, in the top right corner, there is a rubric that we have students complete the rubric pre-game, and it's based on the learning outcomes, how well they think they're going to do. Any areas that they think they're struggling in, we're now developing resources for them. When they click on saying that they don't feel comfortable on one of the outcomes, it will provide them a link to resources. Then they complete it at the end and see how well they feel they performed. And this is a way for them to actually evaluate their own performance. These are adult learners. This is a great way. So we'll continue on with that. It evaluates knowledge, application of knowledge. It visualizes incorrect decision makes. Not only can you visualize what will happen with a wrong answer, but you'll have the rationale to support why it's wrong. And it allows for various perspectives. Currently, we primarily are doing it from the nursing perspective. The nurse wears the GoPro, but the sky's the limit. You can have the patient wear the GoPro, so everything from the patient's perspective. You can have it third-person perspective. You can do a combination. Whatever you're interested in, whatever is relevant to the scenario, you'll be able to do.
There was a slide that was missing. Oh, you took it out.
Okay, so we're continuing on as we've completed the virtual simulation games. As I said, we're up to about 20 games, and right now Marion and I think we're in the process of making, oh my goodness, 18 games right now. In the next few months, we've already made a dent in them. I think we've got about 5 done.
Yeah.
So we're working with Dr. Kevin Wu here at Queen's University. He is an international expert on wound care. We're making a 10-game series of different wounds, pressure sores, venous insufficiency, arterial insufficiency, and then we're going to follow it up with a nurse seeing various patients. And basically there's 10 decision points. They assess the wound, they treat the wound, they evaluate the wound, and provide resources. We have Alberta Children's Hospital. After their co-rotation of the aorta, they're very, very excited to make more games. So we're in the process of helping them create some ECMO-related training resources. We've received grant money with a group for making cultural humility focused games for the LGBTQ community. It's really for nurses to better prepare them to provide culturally safe and appropriate care to the LGBT community. So we're making 4 games, bilingual games, so transgender youth, older gay men. We're in talks with Durham UIT to potentially make a game on Breaking Bad News. That's just in the beginning stages. And we've been invited to be keynote speakers, and plus we're going to do a 2-day workshop at the WCSI, Western Canada Health Science Conference. That's going to be taking place in Kamloops, BC in May of this year. Kelowna, sorry.
Kelowna.
I know it's a K. I am so bad. I am so sorry. Kelowna. So too many Ks. So we're going to show you a couple of the games. Now, these games are just being developed. We filmed them all. I'm putting them together. It takes me about a day and a half to put the games together. So here's a LGBTQ older adult game. My mother's 87. She was one of the directors with it, so she helped us with the clapper. And it's her neighbor friend who is a older gay man. He and his partner. So we'll show you that game now. So he wanted to go by his own name, and so I'm still
It's going fast.
sorry, I'm going fast only because you don't need to see all that. So it tells you the learning outcomes. It'll provide a safe summary.
Hello, Mr. Coomer. May I call you Wolfie?
Yes.
Hi, my name is Jane, and I'm your nurse today. I see from your change note that you came here today to lose weight loss and some increased fatigue over the last few months.
I decided that I had another changes.
Can you tell me a little bit more about these changes?
A couple of months ago, my friend died. I worked enough of my husband.
So the sound's a little bit off right now. It's not on the game, but
Oh, so when you said the love, you mean, so like you're queer. I didn't realize.
I don't like that word. It's offensive.
so she had said he was queer, LGBTQ. And this talks about the older adult. Oftentimes, queer is not an appropriate term, and this tells you why it's not an appropriate term. It tends to be reclaimed by the younger population. So it returns to the option and then validates.
It's too bad you lost your friends. I assume though at your age you've lost a lot of friends, which can make this loss even more difficult. I also have friends that I love like family. But just know that although it's difficult to lose a friend, at least it wasn't your spouse.
So these are things that my mother, he hears. We sat down and talked to them. With the older gay adult, I'm just gonna move, sorry, I'm just gonna move back. So with the older gay adult, they have unique needs. So one of the things is he has never, sorry, I'm just gonna pause this for a second. He has never really told people that he's gay. His partner has always been, they always state that he's his cousin. And he grew up in Germany. His cousin grew up in Holland. So they've had some unique opportunities. When they were younger, they would have been killed if they had told anyone that they were gay. So they have unique challenges. Older gay adults have grieving, unique grieving challenges. They have financial constraints. So it broached all of those topics. Next, and I'm sorry about the sound. The sound will be great on the game. It's just I
Recorded it.
over recording.
Yeah.
So see, I'm not that techie. So here's our wound care series. I wanted to show you what it looked like.
This is Mrs. Tampney. She's an 80-year-old female of Medicine Falls. She lives with her sister. Mobility-wise, she uses a wheelchair, so relatively immobile. Her past history includes a stroke with left side weakness 2 years ago, type 2 diabetes, and has been losing weight as of recently, at least 5 kilograms in the last month. She's on multiple medications, including prednisone, which look at her skin integrity. She has a dressing in her lower back that I haven't had the chance to assess yet. She also is complaining of pain in that area. I have completed most of her admission assessments, but still need to look under the breast when you finish this assessment.
So right there, you can see, I just want to stop it for a second. So the actors there were my son, my mother, Free. You have up in the top corner here is the measures assessment tool. You click that, a pop-up will tell you how to assess a wound, the protocol for assessing the wound. So we worked with Dr. Wu here, and one of the things that we wanted to make sure was the nursing or the learner had to do is identify the risk factors for a pressure injury beyond what is obvious, so the obvious pressure shear. So they said that she was on prednisone, diabetes, or immobility.
Hey nurse, I've been laying there for a couple of hours. My back's really hurting. Somebody help me.
So I haven't done the rationale yet.
Yes. Great. Just finished checking your blood pressure here. It's 90 over 72. Now, let me take a look at your labs.
Okay, so I'm just going to go, I'm just looking at the time there, but basically we'll move forward. And so we were able to kind of follow that same format with all of our games that we're doing for the wound care.
So the third aspect of this presentation was to talk just a little bit about faculty development. We've already mentioned that CASN has the new program with the 4 modules to prepare you for the CASN certification. Jane and I and our colleagues from the Ontario Simulation Alliance, including Leslie, have been involved in simulation design and facilitation workshops with the process that was developed from our original MTCU grant. And then more recently through CanSim,
Jane and I and some of our colleagues have been involved in the virtual simulation design and production workshops. And we have a nice 2-day workshop now where we can cover developing the script and filming the game and beginning to insert the game into the template. And so we've been, as Jane has mentioned, we've traveled to a few places. We'll be at the WICSI conference, and there may be a opportunity to do a workshop in the fall in Ottawa, but we'll leave that till later to let you know more about that.
And these workshops, we're not trying to make money on them at all. The cost of the workshop is basically the cost for us to come there, and our hotel and accommodations and our transportation. We want to make this usable to everyone. We want them to be freely shared so that everybody can access them. There is no cost to joining Ontario Simulation Alliance, the Virtual Community of Learning, or CASN. We want this to be freely available because it's innovative right now. It won't be in 5-10 years. So let's maximize nurses' ability to provide optimal education and simulation.
And so if you take one of our workshops, we just ask that you contribute any games that you develop using our template to the CanSim Alliance so that we can share them across the country. So what we've found is that we've developed this way to make easy, cost-effective ways to make our games. We have multiple ways that they can be used in nursing education. So they can be used for pre-simulation preparation, or they can be used as standalone simulations to replace a live simulation. The only thing you have to consider is if you're not doing a live simulation, that you do still need to debrief the virtual simulation game. And with Marg Verkyle, we're looking at what are the best ways to do that. So that's something that still needs to be explored more. The usability studies have showed that the games are easy to use and engaging and innovative and fun, and we're hoping that this will improve the preparation of our learners for simulation.
And this doesn't only have to be for nursing education. You can use this for continuing education for nurses in the field. So here's our website, www.can-sim.ca. Here's the virtual game preview. So we've got the pre-simulation preparations games that we are giving you the free scenario, the full in-person scenario, the learning outcomes, an evaluation rubric, a link to the game for resources for you. We have webinar series that we try to do every couple of months that are free, and I've posted the webinars on the site. We have our simulation scenarios that are bilingual that are available. We just ask that you provide one in kind for us. Partially funding for our virtual simulation games was eCampus Ontario. Both Marion and I, through Trent University, Queen's University, received some funding for the virtual simulation, pre-simulation preparation games, along with the government in Ontario. Alberta Children's Hospital sponsored us to go there to show how to make the games there. And I have to say, for 3 of us to fly to Alberta, make the games, it was under $3,000 for all of that. We received no funding from GoPro or Articulate, but if anyone is related to them and they want to help us, that'd be great. And there's some references for you for further information and that you may want related to virtual gaming. Okay. Thank you so much, Marion and Jane. This has been very informative, and I just want to be sure that we can address the questions that were asked a little earlier. There was a question about the resuscitation, the cardiac arrest game. Is that available open access? And if so, where would they find it?
So that particular game is being used by my graduate student currently. And so once his research is completed, it will be available on the CanSim website for members.
And to be a member, we said you just have to share either a virtual game or a scenario to get access to that.
There are 3 pre-simulation preparation games that are available currently, open access on our website. And the virtual community of learning also has some free games that are available.
Okay, thank you.
So
There
check
was
out
also
those sites.
a question about the use of PowerPoint. Is the platform that you use for the games a PowerPoint or a Microsoft PowerPoint platform?
No, it's articulate software. The PowerPoints that you saw, we actually recorded on Zoom so that we could show you the videos quickly without having to go in and out of our presentation. And that's why the video and the sound wasn't optimal. It's much better quality when you see it online. So I have all the games that we make online, and it's much smoother, but video recording, and then video recording it.
Okay, thank you. Now I have to say there's a couple of comments here I'd like to share with everyone. I used the respiratory distress video in my class on pulmonary embolism, and it was fun and elicited discussion in some of the decision points. I've also used the games for students who are not in simulation, so those are the ones that are in the observing or waiting phase, and the students loved it. So I just wanted to share that. And also there's a comment, is it possible to distribute the reference list? And so I believe Julia said are these slides going to be posted as well, or is it just the reference list?
I think we can post the reference list. We'll be happy to share that. There's also the de-escalation of the angry patient. That's a male patient, a female patient, the same script in French and English. I'm finishing tweaking them, and they will also, the pre-simulation game will be available shortly. And I've also made it in a full 10 decision point game, male, female, French, English. And I just have to get a few hours, well, quite a few hours to finish them, and I'll get that. That's coming. That's our biggest drawback, is that it's taking up a lot of our time. And so we haven't got everything up on the website yet, but it's coming. Yeah, it's coming. So we encourage you to go to the website and join, and then you can
that's great. Yes, now I'm not sure if we have a few minutes left, just a very few minutes here. One of the questions that I have would be around, who would you put on your team, your development team, for creating virtual simulation or virtual gaming?
Basically, you just need the content experts right now. We have set everything up. We will come to you and show you how, or you come to us, we'll show you how to make the game through our workshop. Once you have that, all of it, and we'll show you how to use the software, how to, I put the games together, and again, I am not techie. I have a manual that we've developed to show you step by step how to use it. It's so simple. So you just need the content experts. And so you write the script, making sure that you have the content experts to bounce ideas off. What you may not even think of, they'll have some other ideas. So that's a great resource. I usually try to have 3 people at least on your writing team. And now that we have this organization across Canada, if you do want it to be peer reviewed beyond your own group, then we can, you can just ask for someone that you know has the clinical expertise that you're looking for. And the Ontario Simulation Alliance right now, who have a lot of the scenarios that we're sharing with CASN, they're in the process of peer reviewing all of the scenarios. So if you're interested in being a peer reviewer or you want to contribute, that would be fantastic. We're going to rely on each other. This is all free. So yeah, for it to be continued, we just need everybody's opportunities to help and share.
That's great. So thank you so much for your presentation today. I know that I learned a lot. I learned a lot about how to develop games, but also how important it is to have the whole package, how important it is to have that plug and play. That's really, and you've already done all the pain. You've taken all the pain for the rest of us. You've worked out the kinks.
We've worked out the kinks. Yeah, we've worked out lots of little.
Yes, and thank you so much for sharing it and opening up access so that the simulation community can really benefit from your work. So I'm always so amazed by the creativity and ingenuity that goes into each of the game development. So thank you once again to Dr. Tyerman and Dr. Lecter-Flood for sharing your knowledge and expertise. And I would urge the rest of our simulation educators to continue the dialogue. You've got their contact information, so reach out to them. I'd also like to give a special thank you to Dr. Baker and the team at CASN for having this opportunity and sponsoring this webinar to bring the country together. And of course, a special thanks to Julia, who makes sure this all goes off without a hitch. So thank you so much, and everyone have a great weekend.
Thanks, everyone.
Thank you.
Thanks, everybody, for joining us.